Thank you. Thank you for the introduction, and thank you for having me here today. So this work is a joint work between Carton, specifically two of my former colleagues, Javier Perez Trufero and Miguel Alvarez, and Professor Jorge Mateo from University Jaume I. When it comes to inequality and COVID, we now all know that inequality can affect the outcome of the disease. For example, we know that some pre-existing conditions such as diabetes or heart disease are more prevalent in the low-level socioeconomic population. But what about the risk of infection? For sure, we might think that self-protective behaviors or the awareness of different types of risks might differ between different sections of the society. Ideally, if we want to study the association between the risk of infection from COVID-19 and the underlying socioeconomic and demographic characteristics of an area, we would look at case counts data. However, we know that, especially in the early stages of the epidemic, these data suffer from very large sampling and selection biases, as well as delays in reporting. On the other hand, human mobility is one of the main drivers of the epidemic. And as this has been already stated today, data from large mobility panels, including Google and Apple, was made available right from the start. In this work, we developed a framework to understand at the community level the association between changes in human mobility and the underlying socioeconomic and demographic characteristics of an area, in order to understand how well the different sections of the society are likely to react to non-pharmaceutical interventions, such as stay-at-home orders, and therefore reduce the spread of disease and decrease the risk of contagion. If we plot, for example, the percentage change in workplace mobility from Google, which is defined as the number of devices at work, in the first wave of the US epidemic, we will see that for the different counties, here the orange lines, we see some similar patterns. After the national emergency was declared, the percentage change in workplace mobility suddenly decreased and then started increasing again. We can identify two main phases during the first wave. First phase that we called the lockdown phase, where the strictest lockdown conditions were in place, and then a following phase where mobility started recovering slowly. However, despite these common patterns, we can also see that there are large differences between the different counties. So we might wonder what are these differences about, if they are linked, for example, to the socioeconomic attributes of that county. We can, for example, start by looking at grouping the percentage change in workplace mobility according to the percentile of the median household income of that county. And what we would find, and this has been noted by others as well, is that richer counties dropped their mobility more than poorer counties. However, this graph is only exploratory, and we know that income has multiple dimensions, which are not limited to income alone. And to really study the association between changes in human mobility and socioeconomic attributes, we need a statistical model. Here, we are using a Bayesian hierarchical generalized linear model where the likelihood is a beta likelihood, and we are modeling separately for the lockdown and recovery phase, as identified before, the overall change in workplace mobility. The fixed effects that we included in the model are the principal component scores from the US census data. In our baseline model, we used only the first six principal component scores that corresponds about to 55% of the variance. And we also included another covariate as a proxy of the risk awareness, which was defined as the number of cumulative cases as of the last day of each phase. Here in these two maps, you can see, for example, for the lockdown phase, the Y variable, which is what we want to predict on the top, and on the bottom, the risk awareness variable. In order to select the best model, we did different tests. We tested which likelihood was the best. We tested for potential partial mediator effects of the risk awareness variable. We tested what happens if we include more principal component constructs from the US census data to the model, arriving to about 90% of the census variance explained. And we also tested two additional models that might able to find any structure in the residual variability. One is a model that adds an additional term that models potential county level random effects. And another, and this is the IID model here, and another model that apart from this additional term also includes another additional terms that is able to model any proximity effects between neighboring counties. This table here that looks a bit complicated shows the performances of all these models. And there are two main things that we need to notice here. The first is that the variance explained by our model is much higher during the lockdown phase than the recovery phase. And this means that the socioeconomic attributes of the county, conditional on the awareness of risk, are a much better predictor of the changes in mobility when the lockdown conditions were the strictest compared to when mobility started recovering. And the other thing that we want to notice here is that by adding the proximity effect, we are able to improve the model performance significantly, going from 40% of explained variance in the lockdown phase to more than 70%, and from 10% to 70% in the recovery phase. And this extra variability that is well represented by the proximity effects is only partially explicable, accounting for more principal component scores from the US Census. We can also use this model for inference and by looking at the posterior estimates of the model coefficients or equivalently of the odds ratio as shown here in the second and third row for the lockdown and recovery phase correspondingly. In order to interpret the results from the principal component scores, we need to combine these posterior estimates with the correlations for each principal component score and the original variables. And if we do that, we find that conditional on the awareness of risk, counties with a higher proportion of workforce, with a higher family income, with a higher median age and denser neighborhoods, and with a lower proportion of Hispanic population drop their mobility more, but also recovered the mobility pattern more in the following phase. On the other hand, less populated areas also drop the mobility more during the lockdown phase, but also increase the mobility less in the following phase. And this might be related to the fact that families with children, while they followed promptly in the lockdown orders, they struggle to recover their mobility because schools remain closed. The other thing that we can notice here is that we found during the lockdown phase a higher counties with a higher proportion of multiple race population, which mainly corresponds to the Native American territory, dropped the mobility more. And this actually reflects the fact that this territory was highly hit during the first wave and went under one of the strictest lockdowns. If we look at the variability captured by the county level random effects and the spatial proximity effects, we see that in both phases there is a lot of clustering, but this clustering, as we have noticed before, is only partly explicable by the variance that was not accounted for from the US Census data in our baseline model. On the other hand, local restrictions would induce similar behaviors in nearby counties. So what we're seeing here is probably the result of county and state-wise lockdown orders. Here in this work, we have developed a framework that allow us to understand at the community level the association between changes in workplace mobility and the underlying socioeconomic characteristics of an area. We have applied it to the first wave of the US epidemic at the county level, and we found that during the early stage, socioeconomic attributes are able to predict quite well. They explain variances about 40%, the changes in workplace mobility. There is also a lot of extra variability that is not accounted for these socioeconomic attributes, and this extra variability can be well explained by adding proximity effects that account for similar behaviors between nearby counties. And these proximity effects are likely related to state and county-wise regulations. We think that by applying this framework, this can help policymakers to target those communities that are less likely to be able to adapt to social distancing strategies and therefore more likely to get infected and contribute to the spread of the disease. If you are more interested, if you're interested in the details of this analysis, this work is under revision now for the American statistician, but there is a now quite old preprint available, and also the code is available on GitHub. So thank you a lot, and I'll take any question.
Thank you, Giulia, for a very nice presentation. So we have a few questions for you. The first one is, you mentioned that you included the proximity effect in your model. Could you tell us a bit more about how you did this?
Yes, sure. So the model that we specifically used is a model that accounts for the neighborhood structure through an adjacency matrix. And I don't know if you know this type of models, but to do that, it uses a prior that is called conditionally autoregressive model. It is quite straightforward to include it in a Bayesian framework, although it can lead to some confounding with the fixed effects, in this case, the socioeconomic attributes and the risk awareness variable. But maybe I can get back to my, I can't. If we look at the posterior estimates of the baseline model and compare that to our estimates using the spatial model, we can see that the confounding is actually minimal. So the proximity effects are actually explaining some variability that is not explained by the principal component scores from the US Census that we included.
Thank you. And another question is, how did you do the training and test split of your data?
Yeah, so we did it randomly because we were including in our model the proximity effects. So we couldn't do it spatially because otherwise we wouldn't have been able to see the effect of the proximity effect.
Okay, so there was a random split.
Yes, it's about, I think, 70 to 30%, if I recall well.
And another question that comes to my mind is, so have you looked also, so you are looking at the first wave, but have you also tried to look at what happened in the subsequent waves, as also for other presentations we asked the same question. Does the picture change somehow after the experience of the first lockdown, or not?
It would be really nice to do that. I haven't done that yet, but yes, that's definitely something that would be interesting to do, as well as to try to go more at high resolution. So Google only gives data up to the county level, but there are other providers that also offers data at the block group level, for example. So maybe, although this analysis couldn't be, it would be difficult to apply to the whole US, it would be interesting to focus on some urban areas, for example, as it has been done in Chile in the previous presentation.